Welcome, everyone, to the 313 Coalition for Families and Students. We are so excited to be here this week with you again today. My name is Christine Bell. I am honored to serve as the Executive Director of Urban Neighborhood Initiatives and a really proud member of this coalition. I'm really excited to be here with all of you today because we are going to hear from some amazing doctors in our community, and we're going to get all the questions answered that we can about COVID, what's current, testing, all sorts of good stuff. But before we go into the program, we want to let you know that we have people monitoring the Facebook chat. And so Lindsay is out there and she is waiting for your questions. So please make sure you put those in the Facebook chat. We really want to hear from you. And just to make sure she's on her toes, why don't you let us know where you're joining us from today and what you're most excited about in the coming weeks, and maybe what you're most nervous about as it relates to COVID. Like always, we're translating the town hall into Spanish and ASL. So let's give folks a little bit of time to get to the right place. Christina, can you please give us the details on how to listen to Spanish interpretation?
Buenas tardes, pueden escuchar interpretación en vivo en el Facebook de Urban Neighborhood Initiatives y el link lo van a poner en el chat. Gracias.
Thank you, Christina. It's so good to have you with us today. And Julie, if you could share the instructions for ASL interpretation. Julie, thank you so much. And it's amazing to have you back. And we have a new interpreter, Carly, that is also here. So I'm going to kick it over to Jametta Lilly, my co-moderator. Jametta?
Yes, thank you, Christine, and welcome everybody to another one of our awesome COVID-313 community town halls. We have a particularly exciting program today, and we know that there's going to be information and knowledge that can help keep you and your children and your family and our community safe. I want to thank both Katie and Christina. And I want to remind our speakers that if you would, to please speak slowly enough that our interpreters can share your important information as we move forward. And also just to reiterate that Terry Whitfield, who is our awesome timekeeper, will nudge you, or either Christine or I might come on in the event we need to move the program forward, just as a gentle reminder. So as I mentioned today, we have a particularly great town hall. I mean, we are in the midst still of COVID. And we know that with our children having gone back to school, more activities that both adults and children are engaged in, that we're seeing an uptick in the city of Detroit, while it may be lower in some other places. So it's really important that we get to hear your questions and that we get to hear answers from our reliable and trusted resources. But to help us have a conversation with Dr. Valbuena, who is the CEO of CHAZ, one of our very significant community health clinics in our community, and also with Dr. Cunningham, who is a pediatrician with Henry Ford Hospital. They're going to provide some really important answers to us. But to help us think about those answers, let's have a personal story. So I'm going to ask that Rajeshri Bhatia, who is part of our initiative, to come on and share your story with COVID. And let's listen to that and give the opportunity Dr. Valbuena, as well as Dr. Cunningham, to respond to a lot of those issues that she's going to bring up. By the way, it's wonderful to see you, Rajeshri, and your beautiful baby with you. So let me turn it over to you and kindly tell us your powerful story.
Thank you, Jametta. Hi, everybody. Usually I play a different role on this town hall, but today I'm here to share our experience in the hopes that it helps spur some conversation and gives someone else some information that might be helpful to you in the long run. My entire family has COVID. We're vaccinated, we wear masks when we go out, we limit our social interactions, and in general, we're very careful. We act this way because we're concerned about the community and about others, and because we have a 1-year-old, as you can see, and a 6-year-old, both of whom are vulnerable as they're not yet vaccinated. We've also lost loved ones to COVID and know firsthand the potential dangers. So it's really been important to us to be careful, or as careful as possible. None of us showed typical symptoms that we've all been on alert for. None of us had a fever or any loss of taste or smell, no body aches, no nothing, until well after we tested positive. But before that, there was nothing. In fact, I had no symptoms, nothing. And the only reason I even got tested initially was because I had a cough. And I knew I was potentially going to be seeing people in person the following week. And I wanted to make sure that I could reassure them that I was safe to be around. So it took me 2 days to get a testing appointment. It took me about 2.5 days to get my results. But all the while, I really didn't think I was, anything was going to come of it. Imagine my surprise when nearly 5 days after I had my first cough, my PCR test came back positive. Again, because we're cautious, I didn't go anywhere during that time because I had a cough. Someone said to me the other day, coughing and sneezing is the new smoking. You don't want to do that around other people. So I also was cautious and stayed home. So I know that we limited the spread very, tremendously, but it was in my own household. As soon as I received my positive results, I immediately had the rest of my family, our children, my husband, and our babysitter, who's part of our household, tested. Because I have a friend who's a physician, and only because of that, I was able to get a rapid PCR test and had results within 12 hours. Everyone except for my 6-year-old tested positive, and my 6-year-old required another test because hers was inconclusive. Eventually, she did test negative, and we learned that she'd already had COVID based on the fact that she had antibodies. She was completely asymptomatic, so we had absolutely no idea. And while we don't know for sure, it is most likely that she got it at school, and then that's how we were all infected. Learning we were positive brought up a host of issues. Who did we need to tell, and what do we need to do? How do 2 parents that have tested positive care for a child who's tested negative? I've been a part of this COVID313 coalition and been attended these town halls for the last 80 weeks. I interview doctors every week and ask them questions. Even so, once it hit home for me, I was completely clueless on what to do. It was like I'd forgotten everything I'd learned because all of a sudden it became personal. Luckily, I was able to use the resources that this coalition has put together and quickly figured out what I needed to do to keep my family safe. My older child was sent to stay with my parents, who have had no contact with us for the last 2 weeks. For whatever reason, usually we see them every day, but for whatever reason, we hadn't seen them, and they were negative. We continue to monitor the baby's breathing, temperature, fluid intake, and we use a pulse oximeter to ensure that she has enough oxygen, and we're doing the same thing for the rest of us. This experience has been so eye-opening, and while I'm really relieved we're on the path to recovery, I also realize just how limited our response systems are, and that a lack of resources could have resulted in my family spreading the virus despite our best intentions. First thing to consider, all the adults in our case are vaccinated, and yet we had 3 breakthrough cases. It's important to remember vaccines don't make us superhuman. They protect us for a period of time, but we still need to be careful. Someone might say, well, the vaccine didn't do you any good. Why'd you even get it? And I completely disagree. It kept me safe for as long as it was able to, and it lessened the symptoms so that we were all able to manage without needing hospital care. I don't want to know what would have happened if we weren't vaccinated. My guess is that we probably would have gotten it sooner, and we probably would have had very severe cases. The vaccine worked. It did exactly what it's supposed to do. We're about 7.5 months after our second vaccination, which means we're ready for a booster. I'm just waiting for our booster to become available because as of right now, the Moderna, as far as I know, is not yet available. The second thing that kind of really came to light for me is that it took nearly 5 days from the onset of my cough for me to know I have a positive result. I was vigilant and I found an appointment. It took me 2 days to get in, but I had to drive about 15 minutes away from my house to get that appointment. It took me 3 days to get the result. And I acted as if I was positive in that interim period. Had I not done that, I could have infected lots of people through simple contact. But I stayed home, limited my contact, even though I didn't think it was going to be positive. We also had the results delayed for one of my children because there was a typo in my email address, which was the only way the lab could contact me. It took the physician calling the lab multiple times on a Friday evening for me to get my result. And the only reason that this was possible was because she was willing to do that. Otherwise, we may not have been able to retrieve the result, and we certainly would not have gotten it as quickly. Because we found out very quickly that we were all infected, we were able to take action and limit again the spread. It just seems like the processes can be improved so that more appointments are available, results come more quickly, and we use more than one way to contact a patient. Email is great, but it's not the only way. We've got phones, we've got texts, we've got lots of different ways. Thirdly, my child had COVID and I didn't even know it. I didn't even suspect it. And I'm really careful to watch for any kind of symptoms. I know that the school is doing what it can through health screens and everyone wearing masks and limiting indoor unmasked contact during lunch, but it's still out there and probably more prevalent than we realize. As more people pass the 6-month mark for vaccines, and as we start spending more time inside when the weather gets cold, there is likely to be more opportunity for us to catch the virus, which means vaccinations, boosters, and just safe hygiene are of utmost importance right now. Lastly, it's really important that households with positive tests do what they can do to keep the spread from happening at home. We're very lucky that we're able to send our daughter to stay with relatives. However, if our baby had been negative, we would not have been able to do that. So we would have had to come up with a plan of how we were going to care for her while also keeping her as safe as possible. In retrospect, I wish I'd thought this through ahead of time. I wish I'd had a plan because it's a lot harder to come up with a plan when you're in the middle of it than it is to think through with calm head ahead of time. So I would encourage you to think through that. What would you do if you get it in your household? If everybody has it, if only some of you have it, even if it's just designating this is the area or these are the rooms where the positive folks will stay. We're going to remember, we're going to open our windows every so often. And if we're all in the car together, keep them open. These are the kinds of small things that can help reduce the spread within a household. And again, it's a lot easier to think about those things ahead of time than it is to do it when you're in the situation. Taking from that, I've already started thinking about how am I going to make sure my house is clean after we're done with this. So we've started making a list and making sure that we don't miss something. Granted, the virus does not necessarily live on surfaces for very long, but we still want to take every precaution. We're lucky to be in healing mode and very lucky that we were vaccinated and that we're healing, recovering well. I hope that sharing our story helps anyone in case your family tests positive and serves as a springboard to improving our testing and communication systems. Be sure to bookmark the resources from this coalition because in all honesty, it is my first place that I went to get all the information I needed, and it's what's helped me sort of deal with this as we move on. Thanks for listening.
Rajeshri, thank you so much for really sharing a really poignant and personal story. And it is a joy to hear your little one babbling and doing the things that we want our babies to be able to do, and that she's weathering through this. So, and that you're weathering through it. And I must say, even I know we need to switch to our doctors really quick. I think there are two things that if I would ask as families are listening to this, that Rajeshri made the point. It doesn't matter how many times that you may be aware of something and have resources. Once something hits you, it's really hard to suddenly get your equilibrium to go ahead and get the answers. The beauty is that you had the background, you had the intelligence and the support to get the answers. So Dr. Valbuena, I want to kick it to you first, because you work with a population that in many cases doesn't have all of the kinds of opportunities and resources that that Rajeshri and her wonderful family have. So if you could kind of respond to that, but I just first want to open it up to you as the CEO of CHAZ. You're living this almost every day, but anything that you'd like to share with Rajeshri, and then we can go into some questions with you and then also Dr. Cunningham.
Great, thank you. I'm very glad to be able to be here with all of you today to share information regarding this. Rajeshri's story is a story that we're seeing more and more frequently, even in individuals that have been vaccinated. Again, she said it very eloquently and correctly, that even though we're getting the vaccines aren't 100% effective. We do know that getting the vaccine, there's a 10 times less chance of poor outcomes, whether being hospitalized or dying from the virus. So the vaccine still is the best way for all of us to be protected against COVID-19. The experience of Rajishrie's family is happening, as I said, more frequently, especially with the Delta variant, as well as children going back to school. So as all of you know, it's coming soon, but if you're less than 12 years of age, you can't get the vaccine yet. Hopefully by the end of this month, the 5 to 11-year-olds will have access to the Pfizer vaccine. We're waiting on that. But the challenge of identifying, is this cough, is this congestion, is this sneezing, really COVID or not? And confounded now with the flu season upon us, it's going to be very difficult to distinguish. Is this allergies because of the change in weather? Is this COVID? Is this influenza? Is this RSV or other viruses that live among us, that exist among us, is a challenge. To the testing timing, the different types of tests available. I know that there are rapid tests that are going to be scaled up, are available and are going to be scaled up, so you can do a rapid test at home. The PCR test, which is usually done in a medical setting, a hospital, we have those machines here at CHAS also, are going to give you much more accurate results. The timing can be a challenge, and I know that larger institutions are having a little bit more difficulty in scheduling and managing individuals that want to get tested. At CHAS, we're testing Tuesday, Wednesdays, and Friday mornings. It is a PCR test. By the afternoon, we have the results. So usually it's a 24-hour turnaround time, and then the reports can be sent or picked up, for work or for school, because I know that that's what we're seeing a lot of, to make sure that the kids can get back to school, that individuals can get back to work. But the mask is still indispensable, even though the state hasn't officially mandated, and some school districts are, and some school districts aren't. If for those that can't be vaccinated, the mask is indispensable. The 2-layer mask to wear to prevent those particles that we breathe out, those droplets, to transmit the virus to others. And those that are unvaccinated, that can be vaccinated, we still are working nowadays more one-on-one with parents, with children, with adolescents, to dispel myths, to answer questions, to clear any doubt of the effectivity, the efficiency of these vaccines. And then once we get that individual to yes, having the vaccine on demand, you don't have to call and make an appointment. You don't have to go on a website and look for a time. And I'm talking about CHAS as the example here. We are vaccinating 6 days a week, Monday through Saturday. As long as the center's open, you don't have to be a CHAS patient. You don't have to be a Henry Ford patient. And I say that because we're partnered with Henry Ford, and we use Henry Ford's electronic health record. You can walk in and say, I would like a COVID vaccine, and we have Pfizer and we have Moderna available pretty much on demand to be able to vaccinate those that are 12 years of age or older, soon the 5 to 11-year-olds. But I can understand the fear, the frustration, the issues that come up in the whole process of, is this COVID? How long, what do I do in the meantime? How long is it going to take for me to find out? And, why is the vaccine, why isn't it working at 100%? Are all very, very valid questions. And the last thing that I would say real briefly is it's imperative that everybody have a relationship with a primary care provider.
Yeah.
The pediatrician, the internal medicine doctor, the family doctor, because that is your go-to individual for anything regarding health. Anything regarding health and wellness is your primary care provider. So that relationship is extremely important, as well as in this example of COVID. So I would just say that we need to work to get everybody vaccinated. It's not just a state, a local, state, or regional, or even a U.S. issue. This is a global issue. And until we get the vast majority of the world vaccinated, and I know we focus on our little piece so that we get there for our individuals, but this is a large scale problem that until we get it under control at a global level, we won't be moving beyond it. So we're available for testing. We're available for vaccine. Come see us. Thank you.
Yes. So thank you so much, Dr. Valbuena, for making it clear to people about the level of access there really is to not only vaccines, but testing. And to share with families very quickly, please stay with us, because we're going to make sure that you get the list of all of the federally qualified health clinics that are in Detroit and Wayne County that are like Chaz, in the sense that they have resources available for you with clinics all throughout the city, not to mention the clinics that are run by our health systems, whether that's Ascension or Henry Ford. A couple questions for you, Dr. Valbuena, before, because we know you have to leave, and then we're really excited about having more conversation with Dr. Cunningham. You mentioned about how it's kind of difficult for parents to change, to know, is this a cough that's related to the flu? What is this? What do you recommend real specifically, as soon as parents begin to see a change in the health of their child? What are the 2 or 3 questions that they need to ask themselves, and what would you recommend to them that they would do?
I think at this point, because of the environment that we're living in, the time that we're living through, any of these symptoms need to be treated as possible COVID or possible flu until deemed otherwise or diagnosed otherwise. So my initial thought is reach out to your primary care provider, ask the questions, have them see you, and if they feel that you need to get tested at that point in time, then get tested. So the symptoms are all very similar. So it's very difficult to say, if you have a nasal congestion, you're sneezing, you have a little bit of cough, is it allergies? Is it COVID? Is it flu? One of the things I can tell you is the testing that we're doing here, in one sample that we get, we can tell if it's COVID, influenza A, influenza B, or RSV. So we don't have to do 4 separate tests. And we haven't seen any flu yet, but we are seeing some RSV, and that's a virus that mainly affects children. And we're being asked not to test individually for each of those, but because our system tests for all 4 at once, that's helping us. Because if it's flu, we have treatment for that we could quickly diagnose and then be able to say, it's none of these. Could be another virus, but it could be allergies, and then work with the family, in the school, or work to get individuals back to work or back to school in a timely manner, because we know that that's extremely important.
That's really great. So one of the things that Rajishu is making the point was that she and her husband, and as well as her in-laws, are fully vaccinated. And we're hearing the term, and we're hearing it so often, about breakthrough cases. Have you seen any data that tells us how frequent this may be? Because I'm getting this question about, well, is this really significant? Are we seeing only 10%? Are we seeing 50%? Have you seen any data that suggests what the level of breakthrough is for people who have been vaccinated?
So Dr. Cunningham may have more specific data, but I can tell you that initially the Pfizer and Moderna vaccines were protecting us upwards of 90%. With the Delta variant, that dropped some, maybe into the 80s. And so that means that if it's protecting you that much, there's that opposite percentage, or the rest of the percentage to get to 100, that it can affect you. And we know that the Delta variant lives in high numbers in our nasal passages if we're exposed to it. So even though if you're vaccinated, you may not have any symptoms or mild symptoms, but you can easily transmit it to children that have not been vaccinated yet, as well as adults that also have not been vaccinated. So that's why the mask, even though we incentivize people at the beginning, if you're getting your vaccine, you don't have to wear your mask anymore. We're starting to see with the Delta variant and others that are being tracked and followed now that it is indispensable to wear that mask when you're in an enclosed space with individuals that you don't know their vaccine status, to wear that so that we prevent the risk of spread.
So you said something pretty important, and I'm hoping that everybody kind of caught that. So the Delta variant that we know of wasn't here 9 months ago.
Right.
So that the more that we have people who are not vaccinated, can we anticipate that not only do we have things like Delta variants, but there can in fact be other variants that may be even potentially more powerful?
Correct. Until we get everybody vaccinated, there's always that risk because those variants are occurring as the virus is transmitting from one individual, one human being to another human being, and that we would get to a point where a variant surges that these vaccines don't work for, and then we'd be starting from square zero. So again, can't say how important it is to get vaccinated to decrease your risk of being hospitalized or dying from it by 10 times. That's a very significant piece of information that, we're getting data daily with the billions of people that have been vaccinated across the world now and are seeing, and that's why it seems like we're not, people are saying, well, you guys are saying mixed things. Well, because this is new. And as we're getting information, we're giving the best information based on the data that the scientists are collecting as we go through the pandemic.
And we're so pleased that we have people that are community focused like yourself to unbundle that data and make sure that people everywhere in the community could understand. It is complex, but that's why it's important, parents, for us to stay on top of it. Dr. Valbuena, the last question that I would ask you is, if you think about the families that you're seeing so often there at Chaz, many of them cannot, they don't have the advantage of sending someone to someone else's household. Rajushi made such a great point about a plan. What would you say to those families that particularly who are living with multiple generations in the same home? What's the kind of advice that at Chaz you're giving families if in fact they think they are positive, or in fact they've been diagnosed and know that they are COVID infected?
It's extremely difficult. The situation where you have 2, 3 generations or different cousins and uncles and aunts living in the same household. Ideally you want to isolate individuals, but we know that that's not possible. Not sharing utensils, glass, and those things, and as much as possible wearing a mask. But the chances, and as Rajeshri's family shows, everybody in the family got it. The risk is extremely high that once someone gets it, everybody's going to get it. But the more people we get vaccinated, the less the effect of contracting the virus is going to be, and very soon we're going to be able to get down to the age of 5, and hopefully by the beginning of this coming year, even younger than that, like we do with the flu, from 6 months of age and up. So it's very difficult, in the situation where you have many individuals at home, wearing a mask and trying to isolate as much as possible. But the risk right now, especially with the Delta variant, is that it's going to go through the household.
Yeah, thank you so much. So Dr. Valbuena, again, we appreciate you being on the program, and we indeed appreciate the number of clinics that are out there in our community doing this work, not only during the pandemic, but are about making sure, so everyone, make sure that you are connected to a medical home, a place where they know you, where they know your records, where you can get both your oral health care, your behavioral resources, and primary care. We can't emphasize it enough, and Chaz is just one part of the system that's here for us. Dr. Valbuena, thank you so much, and continue to have a blessed and productive day.
My pleasure. Thank you so much.
Thank you. Thank you. So, this is a perfect segue to you, Dr. Cunningham. We just heard from Rajeshri, who has 2 little ones, and this notion that we're on the verge of the need indeed for vaccinations for younger children. Could you come on screen and talk to us about what you're seeing in terms of the testing routines for children, and any recommendations you have, because right now we're seeing an uptick again with our kids. Your thoughts?
Sure. So I do see patients 1 day a week and a wide variety of socioeconomic status. When we have kids who may have symptoms, we are certainly testing them. Henry Ford is very fortunate that we have a 24-hour turnaround. So if I collect a swab on a Friday, I will have results on Saturday morning, which is so important. Some of the rapid tests that people can perform in doctors' offices are actually getting in short supply. A couple of vendors have actually cut how many of the rapid tests we can get. Fortunately, our main lab can actually do it. As demand goes up, there's only so many tests there. It's very hard with kids. Kids may not even show symptoms. They may have an infection, but be completely fine, which could easily have been how someone, they have a kid at school, they bring it home. It's also, I understand the challenges. My mother-in-law was staying with me and she came down with COVID. No one else got it. We had masks wearing and it was nice weather outside, so she could eat outside and spend a lot of her day in the backyard, which I think helped. It's a lot harder in the winter. Another thing that people who are at high risk for having COVID complications, I'm trying to talk slower, I know I go fast. We have monoclonal antibodies, which if people are at risk for, or if they've been exposed or they're infected before they get too sick, we can actually give this to people to help them stay out of the hospital. The vaccines are very good at preventing severe disease, meaning hospitalization and death. These monoclonal antibodies are also extremely effective. I'll put the website for Henry Ford. It talks about what the indications are for these antibodies, but that's another powerful tool we have to help prevent disease.
So you said something important about these rapid tests. So we were beginning to see that there's increased demand for them because people are recognizing how important it is. But at Henry Ford, you have capacity because of being a hospital and a lab that people can still get information in 24 hours?
Yes, our main lab is able to do the PCRs we run it multiple times a day. So it's 24 hours or less for our results.
So let's talk about for parents. Their child has been identified of having been exposed. They have some concern. They're going to keep them quarantined. But while they are at home, as a pediatrician, what do you recommend to parents in terms of keeping our babies as well as our teenagers safe and healthy while they are at home with COVID?
So the important things are you can give Tylenol or children's Motrin if they're having fever or aches. A lot of it's making sure they're at least drinking, especially the young children. You want to make sure they're wetting diapers like usual and not getting dehydrated. There's not a whole lot else to do for this except wait for your body to fight the infection off. You may have seen the news that one of the pharmaceutical companies is going to come out with an oral medication, hopefully to treat COVID. That would be wonderful because right now we really don't have many outpatient options.
That will be huge, won't it? So that we can not only have prevention tools such as our vaccines, but then we can have intervention tools once people have contracted it and how they can potentially get better. Could you talk a little bit about how specifically we're on the verge now of vaccines for children under the age of 12. So in both cases, it requires the parents to make that decision for children. What is it that how are you counseling parents that are calling you or coming in and saying, I'm not sure, what do we want to say to them that would help them better understand the vaccine and how to make a good decision for their child's health?
Sure. So October 14th and 15th, the Food and Drug Administration is looking at booster doses for the Moderna and J&J vaccines. Later in October, they're going to look at the data for children between 5 and 12 years of age. It's the same exact vaccine, the Pfizer vaccine that adults can get. It's just they make the dose a little bit lower because kids are smaller. The safety profile looks great. Again, very similar to adults. It's pretty well tolerated, very rare serious side effects. So when parents ask me what I would do is I tell them, I think the vaccine's good enough. Both of my teenagers received it, as did my wife and I will encourage parents when this vaccine's available to get it for their 5 to 12 years of age. Again, there can be breakthrough disease where people get COVID symptoms after vaccination, but they're not being admitted to the hospital or dying. I review vaccinated people who are admitted to any Henry Ford hospital, and it's usually the very old, over 80 years of age, or people with severe weakened immune systems. Maybe they had an organ transplant or they're having cancer. I'm not seeing healthy people admitted with COVID if they got the vaccine.
That is the great news. And as Rajeshri's story emphasizes, is that the vaccine was doing what it was supposed to do, which was to serve as a barrier, not only to potentially contracting COVID, but also if it does happen, to make sure that you're not at the level of having to go into the hospital. So you've made the point about not seeing adults who have this kind of level of health problems. For children who may have diabetes or on the verge of having being diabetic, if they have other kind of conditions, what do parents need to know in those situations?
So those children would certainly be at increased risk for COVID complications, including hospitalization. So if you have a child who has some chronic medical conditions, if you're worried they may be sick, call your child's primary care provider sooner than later. It's a quick visit. Sometimes I just have a patient come in and we can just swab them. They don't necessarily need to be seen by the doctor, a nurse, or anyone can do the quick swab, and we get those results. It's helpful to know because then you can limit exposure to other people, but more importantly, you can follow those patients at increased risk for COVID. I'd have a low threshold for admitting them to the hospital versus a healthy child.
And so while we're talking about the hospital, do you have any data? Can you give us any idea? We are now into October. Have we seen an increase in the hospitalization of children specifically? And by children, I'm going to say young people under the age of 18.
So Henry Ford doesn't really admit very many children. We only take a few very mild things at one of our hospitals. So the children's hospitals across the country, though, are seeing more COVID admissions. Absolutely.
Which is interesting. So, I mean, you know, as I said, there's some blessings in disguise. While Detroit is under vaccinated and compared to many other areas, it appears that a lot of our families are making a point to stay masked up. And that then is helping to keep the hospitalization rates down. But the very last question I would ask you as a pediatrician and as a scientist, you know, immunizations have been around for a while, right? Could you, for the audience, just kind of list what are some of the immunizations / vaccines that typically children are receiving already?
Sure, tetanus or lockjaw is certainly one. Whooping cough, polio. We haven't seen polio in this country in many decades, thank God. Measles, chicken pox, some bacteria that cause meningitis, infections around the brain called pneumococcus and Neisseria. We have human papillomavirus vaccines. That virus is the most common cause of cervical cancer, throat cancer, penile cancer, rectal cancer, and it's virtually completely stopped with these vaccines. And there's others out there as well. It's really miraculous how well people can do with these vaccines. It's one of the great successes of science.
Yeah, absolutely. And for those of us who've ever witnessed any of these diseases, either here or on an international level, it is literally mind-boggling that people would question the efficacy of vaccines to protect us from things like measles and polio, et cetera. So we want to transition. I'm sure that we have some questions for you, and to thank you so much for the details that you have given.
I want to thank you for doing this. There's so much bad information out there. I really appreciate this group coming together every week to share repeatable information from people who don't have any political agendas or any philosophical agendas. So God bless all of you for doing that. It's so important. What a great service.
Thank you. And it's really our blessing. And quite frankly, and that's why we stick with it, because we're human. And Rajeshri can testify to this. It doesn't matter as a human being how many times sometimes you've heard things. I mean, even you in your own life could say, as a physician, this hit me. And suddenly, you know, my med school stuff just went out the door. But then you're able to pull it back in. So that's why we're here. We're here to empower and to provide knowledge and to repeat it constantly from different people in different ways, because we all learn differently. And hearing something and applying it are two different things, right? So let's talk about that. Christine, do we have any questions from the audience?
We do. We have one about the antibody treatment. So where can you get monoclonal? Is that how you say it, Dr.
It
Cunningham?
is.
Antibody, that's amazing. I've really been practicing my my phonetic sounding out. I have young kids that are learning that. I'm like, oh, that's what I missed. That's why I'm a terrible speller.
That's a great point.
Yeah. Okay. Antibodies treatments. Do you need a prescription, or do you need a prescription as of right now? Can you talk a little bit more about the antibodies?
Sure.
Treatment?
So it has to be given on the advice of a healthcare provider. So any primary care doctor can refer it. Henry Ford offers it, so do the other hospitals. So wherever your provider wants to call, by all means. I put the link to Henry Ford's process on the chat only because there's a listing there of who's eligible for the monoclonal antibodies. And I will tell you, in September, I think Henry Ford administered them 1,131 times. So we are getting a lot of them out there. It's really for those who are older and with chronic medical conditions, but your provider can refer you to any hospital for these antibodies. We're even in some cases having our home care go out and give it to people who are impaired mobility, such as the very elderly or people in wheelchairs who it really is a tremendous burden to get them out to healthcare, especially when they're sick.
So the last question is, you had talked a little bit about, or maybe it was Dr. Valbuena, that the Delta variant, when you take a sample, there's more of the virus in the sample. Did I hear that correctly?
Yes.
Okay. And so does that make, you know, there's now tests that you can buy over the counter. Does that make those tests more reliable because the amount of virus that's in the sample size?
So for the PCR, where we look for the genetics of the virus, it doesn't matter how many viruses are there. It's so good at picking it up. The ones where they're called antigen tests, where they're looking for the proteins of the virus, yeah, it's more likely to be positive with more virus. The important thing is to follow the directions. And when you swab your nose for these self-home tests, it's not just a little dab in the nose. You got to really wipe it around your nostril, because the better the sample, the more accurate the test.
Great. Thank you so much. That's all the questions that we have. And Dr. Cunningham, it's great to have you back. I feel like we haven't seen you in a long time.
It's
So
always a
welcome
pleasure.
back.
I'm still here. You let me know when you need me and I will come.
Oh,
Thank you,
that
Dr.
is so
Cunningham.
great news. Thank you so much, Dr. Cunningham. And by the way, thank you for emphasizing the way to do the testing. I think, Christine, we were laughing about that, but not in a good way earlier, how in some situations they're having the children to self-administer their own test. And, you know, I don't know about most kids, but I can speak to the ones I know. They're not going to be swabbing all up their nose or any way that is uncomfortable. So as adults, and the last question I do want to just kind of put on the table, Rajeshri raised the issue indirectly that she, as a great mom, Christine is a great mom, and many other of the great moms and dads and grandparents that are out there are paying particular attention to their children. So they notice those changes. What would you, in the role of a pediatrician, because you know you're also a psychologist, the counselor, all of it at the same time, what would you say to other family members as they might see a child that is exhibiting some symptoms? What could be some things that community folks might say to a family when they see them with some symptoms, and ways to help us keep all of our children safe? How does the village weigh in on
Yeah,
this?
I think it's fair game if you're a teacher or you're working at a community organization. Hey, I notice your child is sneezing more, or they just seem like they're not right, or they look flushed. I think if you approach it with the right intention, hey, I just want to make sure your child's okay, you might want to think about getting tested, because it may not make a big difference for that particular child if they're pretty healthy, but it's helpful to know who else has been exposed so that we can try and limit the spread. This virus is so good at evading elimination despite everything we're doing, but keeping people home when they're sick is probably the most important step we have.
Thank you. Thank you so much. And so speaking of testing and where to go, so Dr. Cunningham, thank you for being available and saying that you'll come back. We are all locked with you in this, and we want to encourage, again, people to know that the Henry Ford Health Systems and other clinics are available. If you do not have a physician or a pediatrician, and all families with children should have a pediatrician, is to move now, because we want to be healthy through the pandemic and after the pandemic. So we want to bring on Deja
I'm going to
Moss.
say goodbye
yeah,
and
please, go
thank
ahead.
you.
I'm sorry?
Goodbye and thank you.
Oh, thank you, thank you, thank you. And again, many blessings in your work. So families and community, you've heard us, we've been talking about testing, we've been talking about vaccines. We want you to really know how available many of these resources are, and that you don't have to get in your car or get access to the car and drive all the way across town or 20 miles away. One of the things that has happened in the state of Michigan in particular, through the work of the governor, through the Racial Disparities Task Force, through the Department of Health and Human Services, Detroit Health Department, and many others, is to make sure that there's access to healthcare, access to vaccines and testing that's near you. So Deja, would you come on and show us some slides where people can get this information and be able to access the screening or vaccines that they need? First off, so I got to brag on you. So everyone, this is Deja Moss, and she's a relatively new part of our COVID313 coalition. And she is working with our production team as the coordinator. And for any of you who don't know, when you do programs like this, there's a lot of what's called back office work. Calling people, getting things together, Detroit Public TV, doing editing, folks out there connecting Facebook Live. So we're so happy, Deja, to have you on board to work with us, to help us make sure that our town hall is effective in communicating and doing this every single week. So what do you have for us?
Thank you so much, Jametta. So I know that it is very important for everyone to locate testing areas near them or testing sites near them. That is something that many people have been having difficulties with. So we have put together a slideshow that will be posted, but also I want to share my screen and give you all a quick walkthrough on exactly how you can locate this testing yourself. So I'm going to go ahead and share my screen. Just give me a second. Is everyone able to see?
Yes, we can.
Okay, great. So the first thing that you're going to go do is go to michigan.gov/coronavirus. So once you get to that website, of course, it is a Michigan website, so you know that it's legit. You're going to go underneath Contain COVID. So once you go to Contain COVID, we are going to go to Test. So once you get to this web page here, it gives you a quick overview, and you can go ahead and click Find a Test Site. So it then takes you to a website, but you still see the Michigan logo in the corner. That is called Solve Health, SOLV. And it will ask you if you want to allow your location or if you want to block it and manually put it in because you have a different area. So let's say, for instance, I block it and it automatically goes to Detroit, Michigan. The top match, so the closest one, depending on my last location, is going to be the Michigan Department of Health and Human Services. As you can see here, it does offer appointment times that you can select for today. This is not the only one. You can scroll through, and there are other locations where you would be able to get testing. And again, this is going to vary depending on where your location is. So it's going to give you the closest one to you. So say, for instance, I wanted to go to the Michigan Department of Health and Human Services, which is located at this address here, Historic King Salem site. I would just select, let's go with 3:15 p.m. Once I go there, it's going to take me to this who's visiting page. The reason for visit would simply be COVID-19 testing. You would go ahead and put in your name, your birth date, your mobile number, your email. Past that point, it's going to take you to a different page, and then you would receive an appointment confirmation. And it's just that simple.
Wonderful. This is excellent. Okay, families, you know, it's michigan.gov/what?
/coronavirus.
Coronavirus.
And we will
Okay.
be posting these slides as well. I just want to say we will be posting these slides as well. There are slides that have step-by-step directions. So everything that I've shown you here will be outlined with pictures as well in the slides that are posted.
Okay, wonderful. Thank you so much, Deja. And again, welcome aboard. We're pleased to have you with us. And we're also pleased always to have our Detroit Health Department bringing us the latest information of what is occurring in the city of Detroit relevant to COVID, to testing, and our data. So could we ask our representative from the Detroit Health Department to please come on screen? And who is that other than the wonderful
to all you beautiful.
Yes, hello. It's beautiful to see you as well. Okay, Tanea, we're still in the fight. How's it going?
It's going. It's going, and it is a fight.
Yeah.
And I'm mixed feelings about registry. I'm sorry you had to deal with it, but I'm glad you guys are okay. Some of the things that I did write down when talking about, I'll go to the slides and share my screen, just of course, because we have to start with data, of course. Let's see here. Let me go to my screen and just talk about a little bit about where we are in the city of Detroit with this beautiful fight, and going into the schools recently and doing piloting programs, going in and playing COVID feud with the students. But just a little bit of data. Are you able to see my screen?
It hasn't come up yet.
Okay. It's saying you are share screening.
Let's see. Double click. There it is. We got it.
Awesome. So right now, the city of Detroit is, doing very well at 4%. We are actually the lowest in around us. If we look at the other cities around us, Washtenaw is next. Monroe County is 15%. But as you mentioned before, Ms. Lily, Detroit is doing a fantastic job of masking. And we've been out giving out masks, encouraging hand hygiene, going into the schools, going everywhere around the city of Detroit and giving education, encouraging vaccinations, masks, social distancing, and hand hygiene. Right now, the city of Detroit is 45.3 vaccinated. We're coming up. We're coming up.
It's a slight. We're moving on up.
It's a crawl, but we're coming up. But we're taking precautions. I will say that everyone in the city of Detroit has been working hard and diligent about receiving information, about requesting information, and we're trying to be as present as we can, because we know, as Dr. Cunningham mentioned, the Delta variant is out here, and it's no joke. And it's actually more increasive than the other virus that we were fighting last year. So this fight is truly a fight. The original strain, it wouldn't hit maybe 2 people, but Delta variant is more contagious, is more transmittable. We're hitting people. We can talk about the third doses. Basically, the third doses are going to be for those individuals who are, well, the booster shots are eligible for 65 and older, 18 and older if you have an underlying health condition, 18 and older if you have a job where you frequently like public contact,
Mhm.
anywhere public, constantly. I would say restaurants, I want to say when you're out there and you're dealing with the community on a daily basis.
A bus driver, for example. Okay,
Nurses,
someone.
doctors,
Okay,
restaurants,
Mhm.
grocery stores, what we used to call front line workers.
Yeah.
Those that are in the front, that are always present, those that you see, those are the ones. If you're always in the front, a booster is probably good for you.
So that means also our teachers, childcare workers, etc. Okay.
They're in the
good.
front.
Mhm.
Yep, they're in the front of the classes.
Yeah.
So yes, booster shots are Pfizer only. You can get a third dose of Moderna if you are immunocompromised. What is immunocompromised? Immunocompromised, cancer treatments, organ transplants, drugs that you may be taking to make your immune system a little bit lower. But those, you can always call us if you're not sure at 313-876-4000 and talk to a nurse, option number 3, or please call your primary care physician. They see a bigger picture than what we see. They
Right.
know about your blood system. They know about everything about you. And
Or they
that's
should.
why they should. And that's why I heard it earlier. A primary care physician is so important. The ER is there, but a primary care physician will do it. We have plenty of third dose and booster locations. I will say TCF is appointment only. So Monday through Friday, 9 a.m. to 5, but these are readily available. We'll give this information so it's present. Also, I heard the doctors mention earlier, is the allergies a cold,
Mhm.
the flu, or
Flu.
vaccines?
Yeah.
You know, that's important too. I'm sorry, I'm fixing the screen here. That's important to look at because if you're not sure, stay home. I personally just went through this with my son last week and he had a sore throat for 2 days. We went and got tested. They were negative, but who's to say, you know, what it was? I just kept hearing him. And it's important, again, I heard it earlier, stay in tune with your family, stay in tune with your children, because he didn't tell me his throat was hurting, but
Right.
he kept clearing his throat. I know my child, when you know something, when you're staying in tune, pay attention to it. They may not say anything. So the testing sites, Joseph Walker Williams, you do need an appointment. The number you can call 313-230-0505. And that COVID-19, as the young lady just came and she illustrated, that was a perfect illustration of how to get to the michigan.gov coronavirus. And we put in tests under it because it'll take you right to that site, whether you don't have to do so many clicks. But there's also a number, 888-535-6136. Press number 1 and you can talk to somebody about finding the nearest testing location. And also, I know this is a lot of information. You can always call the 230-0505 number and actually get help finding vaccination sites as well.
Mhm.
Masking up, Detroit, doing an excellent job. Making sure you're masked right over your nose, over your mouth, all the way down to your chin. That's masked right. To make sure nothing gets inside, that's the number one thing because we can't see COVID. It's invisible. Who's eligible? 12 and up. What were you going to say?
I was just going to say we are hitting up against time. And so go ahead. How do we contact you?
Community hotline, 4,000. Talk to a nurse. Option 3, schedule your vaccines. I've given all of these numbers. 230-0505 for vaccinations, for COVID testing. Call us. Good Neighbor Program, transportation, homebound program.
Okay. Tanea, thank you for being the wonderful nurse that you are. And thank you to all of the experts that were part of our program today. Today in particular, thank you that you come on week after week. Dr. Cunningham, Dr. Valbuena have made themselves available so that families, we can bring you every week consistent, trusted sources to keep your children and our families and our entire community safe. Deja, thank you for providing that contact information for us. And if you would, Tanea, can you go off screen? And
Yes.
like we do at the end of every single program, we ask everyone who is part of this production and now who has been doing it, I'm not sure, Christine or Molly, is this our 80th week? Have we really been doing this, Lindsay, for 80 weeks?
I think 81 now. Last week was 80.
I was shocked when she said 80 weeks. I was like, wait,
Yeah.
that's the time warp of COVID.
Yeah, so we know that COVID is a time warp. And Majishri, as you mentioned before, you have a COVID baby. One who was born during COVID, has contracted COVID. This child will have stories to tell. And let all of us that are here continue to tell the story of our resiliency, our focus, and our faith in each other and our ability to keep each other safe. So with that, thank you so much. Everyone be blessed, stay strong, and let's keep it moving, keep it moving. Everyone, take care.